Guys, today we are going to talk about the topic balance training. Okay, let's discuss about what is balance. Okay, so balance is the ability, okay, ability to control the body mass or the center of gravity. Okay, uh, body mass or a center of gravity to the base of support. Okay, okay, by this control we can maintain the upright posture. Okay, control of body mass and the center of gravity to the base of support. Okay, so that we can maintain the upright position, upright posture. Okay, or functional equilibrium during dynamic activities. Okay, this is what the balance is. So this is the definition of the balance. Okay, balance is the ability to control the body mass and the center of gravity to the base of support in order to maintain a upright posture or a functional equilibrium in dynamic activities. So this is the definition of the balance. Okay, in humans, what happens? The sensory information from the peripheral end. Okay, so end organs to detect the body position in relation to the environment is integrated. Okay, so that the human balance is maintained. Okay, so the integrated information is interpreted by the CNS and it produces the automatic postural response. Okay, there is integration occurs. Okay, so that is a sensory inputs are going. Okay, what are all the sensory inputs? First, somatosensory input, that is the proprioceptors. Okay, then visual input, and then vestibular input. Okay, so these inputs are responsible for the balance. So proprioceptor are located in the muscles, ligaments, and the joint, whereas visual inputs, the perception of the verticality and object motion or motion of self, okay, yeah, in relation to the environment is also done by the visual. And vestibular, the position of the head in relation to the gravity, relation to the gravity, and linear and angular acceleration of head during movement. So these are all. So first the balance is controlled by the sensory information. So it going to give where am I, then we are going to respond. Okay, that is a motor. So what am I going to do? Okay, so this is a sensory and motor response. So sensory information is done by the sensation we see visual, vestibular, and proprioception, and motor is done by the muscles. Okay, so choice of the body movement and which muscle going to be contract, so that is decided by this. It maximum the ankle muscles or trunk muscles, okay, or a head eye movement. So these like movements are produced here. Okay, let's discuss about the strategies. So strategy means our body automatically respond to some things. Okay, so if we lightly sway away from our normal posture or normal balance way, so it automatically done. Okay, that is a strategies. So we have the ankle strategy, hip strategy, and suspensory strategy and stepping strategy. Okay, so ankle strategy means our ankle going to help to prevent the fall. Okay, the hip strategy means if we have the postural sway, so the term we use the postural sway from the pelvis and the trunk, so the sway is limited by the hip strategy. Then suspensory strategy, when we are suspended, which means when we are hanging, okay, our knee automatically flexes, okay, to lower the center of gravity. Okay, then the balance is maintained. Okay, that is a suspensory strategy. And a stepping strategy, when we attempt to fall, our feet automatically reaches front and our arms automatically go in front, so to increase the center of gravity and the balance is maintained. So these strategies are automatically done. Okay, so base of support is also increased in the stepping strategy. Okay, what's the balance disorder? So balance disorder is a disturbance that causes an individual to feel unsteady. Okay, he is not steady. or having a sensation of a movement, spinning, floating. Okay, so this is the balance disorder disturbance. Any disturbance that to cause the person unsteady or feel any abnormal sensation. Okay, why the balance disorder come? What is the causes? So it is caused by various disorders. Okay, sensory system disorders like sensory ataxia. Okay, vestibular neuronitis and vertigo. That is a benign paroxysmal positional vertigo, neuropathic joints. Then some of the CNS disorders, some motor disorder, some biomechanical problem. Okay, like weakness, limitation of range of motion. Okay, and environmental factors. Okay, furniture worker. So environmental factors, false. So these like causes are there. Okay, so this disorder may also lead to the balance issues. Okay, what is the symptoms of balance disorder? Okay, when balance is impaired, obviously the patient cannot maintain their orientation. Okay, so the person may feel the room spinning, which means he is standard but the room is spinning, like that he can feel. Okay, without support he not able to walk, like that condition may be also occur. Okay, some persons may not able to arise. Okay, some person may feel the dizziness. Okay, and some person may fall or feel of fall. They are not fall, but they have a feeling of fall. Okay, okay, then visual blurring, disorientation are also okay. Okay, so this is what the symptoms is. uh, then we have to assess some areas. Okay, the assessment taken in the visual system. Okay, that is we have to check for the visual acuity and depth perception and visual field defects. Okay, we have to assess these areas. Then come to this proprioception, that is a somatosensory. Okay, here we have to check for the proprioception and cutaneous sensation, that is a skin sensation. Okay, that is a normal touch, normal pressure sensation, like that. And the lower extremity and the trunk. Okay, so these are all we have to check. Okay, and also feet and ankle we have to check. Then come to the vestibular assessment. So here we have to check for the motor responses for the positions. Okay, we have to check for the writing reaction. Yeah, automatic adjustment and restore of normal alignment of the head position. Okay, so that is a writing reactions and the equilibrium reactions. If we fall, if we have the chance of fall, our body automatically go for the equilibrium reactions. Okay, that is maintaining the center of mass and the base of support. Then protective reactions. Our head going to be fall, our body is changing its anything and maintaining the and prevent the fall. Okay, like that our body going to do. So these are all comes under the vestibular. And we have to check for the musculoskeletal elements, which means is there any bone or muscle related problems are there, we have to check for it. Okay, any tightness, contractures, any spasm. Okay, or any range of motion problems. Okay, or any maximum stability problem. So these are all we have to check. Okay, and also muscle strength to check. So this is what about the musculoskeletal elements. Then we have to check for the static balance. Okay, that is a double limb support, single limb support, standing balance. Okay, then come to the dynamic balance, that is standing up from sitting, stepping, stooping. Okay, these are all dynamic balance. And we have to find the scorings. Okay, so we have the 3-point scale, that is the thing is absent or impaired or present. Okay, so this is a 3-point scoring. Okay, and functional balance grade, that is a 0, poor, fair, good, normal, like that we have. Okay, and also we have the Berg balance. Okay, in this 0 means no balance, and 1 2 3 4 are there. Okay, so 1 means support is needed, and 2 means with the hands off they can maintain the balance. 3 they can uh, maintain the balance with hands off, but they have the minimal challenges. 4 means they can maintain the balance and they can accept maximal challenges. Okay, but here they accept only minimal challenges. Okay, so this is for the Berg balance scale. And also we have the rhombus sign. Okay, in this the person is standing with the eyes closed. Okay, then is there any side they are deviating left or right, so this is noted. Okay, then tandem rhombus. Okay, that is the same, but the person keep the legs in the tandem position and their eyes should be closed like that. Then come to the treatment suggestion. So we are assessed. Okay, then treatment suggestion. First, cognitive impairment, which means the person may be confused. Okay, so for those we have to reduce the confusion. Okay, we have to improve the motivation, improve attention, and we have to encourage the consistency. Okay, we have to start with the simple task to the complex task. Okay, then we have to manage the sensory problems. So that is the person having a visual proprioceptive and a vestibular problem. Okay, and we have to manage the strategy selection problem. Okay, so which means to improve the hip strategy we have to maintain the person in to stand on a foam surface. Okay, foam surface, narrow surface, treadmill, so like that we have to do. Okay, appropriate sensory demands should be given, and we have to manage the sequencing and the timing problem. Okay, in which time we have to do which, so that is a sequencing and timing. Okay, so for that we can give the biofeedback balance master. Okay, then we have to manage the preparatory problem. Okay, we have to prepare the muscles. Okay, so some person may having the bradykinesia, we have to do the preparatory problem, so that is a strategy training we have to do. Strategy training is important. And managing the scaling problem. Okay, so scaling problem means which muscle going to contract in which level, so that is a scaling. Okay, so it is maximum happen due to the cerebellar dysfunction. For this we can give the visual biofeedback. Okay, wobble board and weight cuff. Okay, these are all we can give. Here biofeedback plays a major role in the balance issues. Okay, then we have to manage the musculoskeletal problem. That is, we have to give for the range of motion training, muscle strengthening, reduced tone. Okay, for that we have to work. So that is a musculoskeletal problems management. Okay, I already said one thing, that is a sequencing and timing. Okay, so for balance training we have the functional sequence. Okay, let's start with the functional sequence. Okay, so it's always started with the lying, kneeling, then sitting. Okay, this is like a sequence is there. Okay, balance activity start from lying position, then kneeling position, then sitting position. Okay, in lying we have some position: prone lying, okay, and then prone on elbow, then prone on hand, okay, then when sitting, high sitting, kneeling, okay, then high sitting, okay, that is foot on ground with arm support, okay, then weight shift, okay, with arm support, then without arm support, okay, then without the feet touching on the floor, feet touching on floor, then sit walking, that is by sitting the walking, then long sitting. Okay, when come to kneeling, 4 point kneeling, okay, then kneel sitting, 2 point kneeling. 4 point kneeling means two hands are there, okay, 2 point kneeling means only kneelings are there. Then half kneeling, okay, which means one leg kneeling, okay, with support and without support, and we can give first with support, then without support, then we can give the challenges. So like that we have to train the positioning. Challenges are given: first lying, then sitting, then kneeling, okay, then sit to stand, okay, here the standing, double limb stance, single leg stance, tandem position, like that standing positions are there, okay, double limb, single limb, then tandem position, standing, okay, then we have the dynamic, okay, when come to dynamic, static marching, okay, marching in one place, we are marching, we are do the marching action, okay, then wobbling board. Wobbling board is a device. Wobbling board is same like the balance board, okay, here we can place one leg, okay, balance board we can simply remember. Then we are going to the sequence, that is walking, okay, first sit to stand, in the sit to stand static or trained, then dynamic or trained, then come to the walking, okay, that is a forward walking first, then backward, then sideways, then tandem, then briding, then treadmill. What is briding? Briding means zigzag like structure, okay, so we have to walk in a zigzag manner. Then we have to form the steps, ramps, ramp walking, then rough terrain walking, then curb, then we have to introduce the obstacle, then we have to give the community ambulation, okay, steps we know, ramps we know. The curb is a edge part, okay, so in the edge part we have to walk, that is a curbs. Which type of activities we can give? Tasks we can give, okay, look up at the ceiling. Okay, so task like look up at the ceiling, and turning to look behind without moving the feet, okay, so this when and reaching sideways, reaching backward, reaching down to the stool, ball catching and throwing, so these like activities you can give, okay. Then as of what is we can give more environmental modifications, okay, that is a low chairs, low beds, okay, unstable furniture, if they are unstable we can repair immediately. Ladder, step ladder, avoid it. And lack of grab rail, okay, we have to install the grab rail, okay, installation of appropriate handrail, and the stairs and steep, we can do anything, okay, so according to the client we have to do introduce the grab rail, okay, and you have to do the leg modifications, and foot wear made up of a film material so that it avoid the pain, okay, and avoid the shoes, okay, that is heels, high heeled shoes, okay, or shoes that make the imbalance, we have to avoid it, okay, like that. Handrails we can give. Okay guys, in our video we just discussed about the balance training. Thanks for watching guys. Bye bye.